Hi everyone, my name is Liana Laughlin and I am your reigning Mochaning Minalin 2019. I am back from the previous procedure and as you can see, my face has already vastly improved and slimmed down, and a lot of people has actually noticed this and gave me a lot of compliments. Although my face slimmed down, now we need to balance it out with my nose. My nose used to be balanced with my face since I had a chubby face, and I actually have a very sharp and pointed nose. So now that my face is slimmed down, we need to make it a bit smaller so I can balance it out with my facial features.
Good day everyone! Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a follow-up from one of our previous guests, and she's here to show to us the outcome of the procedure that was done to her. Let's welcome Miss Liana.
Yeah. Hi everyone!
Welcome back. Okay, and also we have our associate doctor, Dr. Nina Ong.
Hey, good morning.
Yes. So we're here to discuss about the procedure we have done before, and that was the narrowing or slimming or contouring of our face. So what we did with Liana, we had Ultherapy and also the injection of the masseter chewing muscle with our Geomin product. Okay, and we have heard from Liana that there was really a dramatic improvement. Actually, when I saw her a few days ago, I was really in awe. Wow, diba? It was like jaw-dropping when I saw her. Because I know her face, I know the shape of her face, the size of the face.
Yes.
And when I saw her like 2 days ago, right? And I was, is that you, Liana? It's like she's a different person. It's still her.
Yes.
It's just that we have shaped it and narrowed it in a better contour.
Yes. So parang we emphasize the shape of her face, no?
Yes.
Using
Also,
the procedure.
Exactly. And parang yung jawline region niya, nakita na rin natin. Kasi a lot of people right now, especially young ones,
Yes.
di ba, in your generation, you don't want yung tinatawag na puffy cheeks, chubby cheeks, ano pa ba?
It's actually like the biggest insecurity of our generation.
This
today.
generation right now, yung, si Doktora nasa younger, ano pa ako yung older
Chubby cheeks pa.
generation.
On the selfie generation. it's very
Selfie
important.
generation,
Yes.
yung may angle.
Yes.
Has
Gusto
to
nila
be
may contour.
contoured.
Yes,
Yeah.
exactly.
Diba? Pero, wow, it's really so beautiful. Yung width ng face niya, dito sa lower part, sa jawline, it was, narrower na.
Yes.
We did the injection of our botulinum toxin to slim the masseter muscle. Yung chewing muscle natin
Opo.
dito, kasi isa yun sa nagpapa-widen ng face natin. So, if it's a bigger muscle, so it will make it wider. Or parang sinasabi na mapanga. So, one remedy, non-surgical remedy right now nga is to inject it with that botulinum toxin.
type
You're
A.
narrowing or slimming the masseter muscle, yung chewing muscle. Kasi the muscle na yan, lumalaki pag panay nga ang nguya eh.
Yes.
So you're like exercising that muscle. So you hypertrophy it eh. Lalo mo siyang pinapalaki. So isang tip yun para kung ayaw mo ng malaki yung dito.
Huwag kumain, Doc Nara.
Kumain ng mostly soft.
Soft.
Okay lang naman yung kumakain.
Yes.
Kasi yung mga steak meat, yung matitigas, kung
Opo.
panay-panay.
Or nuts.
Nuts.
Yan.
Tapos, yun nga, panay-panay mong ine-exercise yan. So, mas lumalaki.
Yes.
So, meron mo namang mga food na soft na hindi nakakain. Especially yung mga young ones ngayon, sila ang conscious eh. I think if you want to maintain that, then reduce nga yung pag-chew ng masyadong hard or solid food. And of course, maintain with the injection every 6 months. The
Yes.
others every 9 months. The others once a year. Okay, para lalong mag-narrow yung dito. And then the Ultherapy machine was also effective in making the face smaller and contouring or shaping. And also yung parang lifting effect din. Meron din siya yung Ultherapy. So before kasi talagang rounded yung face ni Liana, right?
Maybe they could check the previous videos,
Yeah.
no? Then you compare on this video.
Right. So now we have shown them the outcome ng procedure. Ngayon naman, we're looking at the face of Liana. And the concern naman kasi ngayon is, of course, nag-narrow yung mukha natin. Some features of the face medyo naha-highlight. So, the center lalo na. Liana kasi is foreign blood, di ba? So, sila yung, ako kasi Pilipina medyo flat bridge, low bridge, wide nose eh. Siya kasi high nose.
Yes.
High nose, pointy tip talaga si Liana eh. So, we wanted to somehow balance na lang dun sa entire face. Kasi lumiit yung face. So, ma-ideally rin maging cute nose. Gawin na natin cuter nose. Eh. Cute na, cuter nose. So, what we're gonna do is non-surgical technique pa rin.
Of course.
Narrow, slim a bit the nose, non-surgically.
Yes.
Busy si Liana, doesn't need any longer recovery period. So we
And longer downtime, no?
We just wanted yung mga injectables lang, tolerable naman. So basically dito sa Alar, sa tip ng nose, and medyo droopy kasi yung tip ng nose eh. I've noticed mga Caucasians, parang pointy pero somehow droop a little bit. So ano ba yung remedy para medyo mag-upturn? Non-surgically. Yan. And also, we'll add na rin, kasi Liana is like, you're modeling and at the same time competing for beauty pageants, right? So, also sa body part, kailangan well-contoured, hindi lang ang face. So, what we're gonna do also, we'll add another procedure, treatment for her.
Yes.
Hindi na tawag na body contouring, shaping particularly the center part of our body, the tummy area. So, syempre, baby pa siya. How young are you again?
17 po.
Oh my gosh, baby. So, may mga baby fats pa dyan. So, kailangan din i-contour yung mga or stubborn fats. Kailangan din natin i-target yan. So, we also do a body contouring non-surgical way. So, ano kaya yung mga treatments na yon? Ating abangan sa pagbabalik ng CSA Certified Skin Authority. Mga ka-CSA, so we will now do a procedure for Liana, that is the nose area. How do we make it smaller? How can we somehow make the shape or the size like balance to the shape of our face? So we mentioned that we narrowed or made the face smaller. And what about the nose region? Kasi parang naging prominent nga naman yung nasal region ni Liana. So, looking at the nose, okay, anatomy of the nose, the root is the radix. And then up here, she has a very good rhinion, yung parang hump na common among Caucasians. And then pagdating dito, merong supratip break. So, it's normal na parang may dent dito. And then the tip region, medyo rounded pa rin yung tip ni Liana. And I've noticed a while ago that it's a little bit downwards or parang naka-droop. Okay? And then the Alar region is meron din siyang widening. So when you smile, try to smile. There's a so-called flaring because we have some muscles here that makes the muscles that will make the alars widen or flare. We call it alar flaring. And I noticed dito, droopy yung tip niya. We have a muscle here called depressor septi, nasalis septi muscle that we also need to relax. So whenever she talks, parang hindi nagdo-droop yung tip of the nose. And it will also help in narrowing the sides of the nose. So the goal for Liana is just to do a non-surgical procedure to slim it or narrow it a bit. Okay? Unlike sa surgery kasi, you can really alter the nose shape. You cut tissues, you cut cartilage. Yes. So, talagang nagnanarrow. But you really totally change the anatomy of the nose. But with the non-surgical, of course, we just wanted to target mga soft tissues lang. And the soft tissue lang, medyo mag-shrink lang or mag-slim lang. Parang yung ginawa natin sa masseter mo, di ba effective dati, pag nag-bite ka, talagang wide, talagang yung muscle is so strong. Tapos we did this same injection, tapos nakita mo lumiit siya. So pag nag-bite ka na, hindi mo na ganong nafe-feel yung muscle. So same thing here. Yun din yung goal natin, to target the soft tissues, usually the muscle tissue or the fatty fibromuscular tissue. Yun ang ini-slim natin. The cartilage, of course, hindi natin mapapalit yung cartilage ng nose. So it's just the soft tissue layers under the skin. Okay, so the product we're using now, botulinum toxin, which is Xeomin. That's the product from MERS. Okay, I'll start with the nasal tip. I can also reduce the shape or make it smaller, make it less rounded. Actually, may pagka-Filipina pa rin si Liana, yung rounded tip din. So, Filipino, known for that.
Siya, no?
Yes. So, I'll be pinching lang the nasal tip and then inject a bit of our Xeomin. Okay, close eyes lang yan.
Close eyes.
So, I have my gauge 13
Inhale lang,
needle.
Adam, mouth.
Yan, okay. So, a little bit inject lang. Medyo yung needle and then pasok yung gamot. Okay. So, medyo sensitive ang nasal tip. Okay. So, yung tinatawag na is ganda ng konti. Okay. So, injecting the nasal tip. Then, after that, okay, normal lang.
Hindi lang sa mouth.
I wanna proceed dun sa depressor septi before I inject the Alars. So, 2 units lang dito. I'll pinch the part of the columella here.
Open
The
your
muscle
mouth.
is under here. Okay, just a bit. And then, konti lang. Ayan. And that's normal. Now, I'll proceed now with the Alar here. Okay. Inhale, exhale. And then, a little bit sa other side. Okay. So, ideally, parang intramuscular injection. So, that's it. So, we're done with the injection of our Xeomin for the Alars, the nasal tip, and the depressor septi muscle under the columella.
Yes.
So, normally, you see the result of this one, 1 to 2 weeks. But with the Xeomin, we have a faster onset of action. It's normal lang na may discomfort kasi sensitive talaga yung sides ng nose. And we'll be checking for the result after 2 weeks. Okay, so we're done with that, with the nose contouring, nose reshaping. Let's proceed with the body contouring. What will we be doing to slim the center part of the body? Our tummy, abdomen. Okay, importante sa kanila yung merong perfect shape. Lalo na Liana is joining a beauty pageant. Merong mga swimwear competition. So they really have to look very sexy and very slim, physically fit, the right dimension. Ano ba yung size ng ilan ba pag waistline?
Around 24, 25 is a good
Wow.
size.
So, kailangan
Achieve
even
natin
below
yun.
that. So, what we're going to do right now is a non-surgical procedure. Again, actually, meron pa silang mga coming events.
Yeah.
So, we'll do a non-surgical technique. And we will be using our Ultraformer machine, which is our ultrasonic fat reduction machine. Okay? So, before doing that, we have to do mga body measurements muna. The abdominal circumference, upper, middle, and lower abdominal circumference. Then we will be comparing after doing the Ultraformer. Now, once I've done the Ultraformer, we will be also doing a mesofat injection to target the fatty layer and reduce those fats.
Hello, KCSA. So we will measure the abdominal part of Liana. I subdivided the abdomen part. So, syempre, midline muna tayo. Then upper, then lower, no? Upper, middle, and lower. So we will measure it using a tape measure. Siguro cm na lang ang gagamitin natin. Then measuring the upper part. That's this part. Sorry, it should be cm. Very comfortable on that. Then relax the abdomen. then it's like 77.5 dun sa upper abdomen niya. Then, on the middle naman, it's 79 cm. Tapos, dun sa navel area. No? Yung navel area, ang ano natin doon, landmark natin doon is
epidermis, subcutaneous fat layer, yun po yung tinatarget natin. So, mesofat injection is composed of mga phosphatidylcholine. These are natural components po ng ating mga fat cells. Ililiquify niya po yung cell wall and then madali na siyang matunaw nun. With the help of our Ultraformer also, with its ultrasonic energy na tumatarget po dun sa fat layer, meron tinatawag na fat coagulation necrosis. So, unti-unti yung mga fat cells na yon namamatay po or nag-necrose, and then i-drain na lang natin sa lymphatic system. Tapos po, yung skin din, at the same time, mag-firm din kasi yung Ultraformer meron siyang formation ng mga collagen, elastin, and other tightening molecules po. So, I have here a cocktail of that fat-dissolving solution. So, ideally, we target saan ba yung area na mas marami yung deposit ng mga fats. So, kay Liana kasi sa upper abdomen niya, medyo meron din, and then mid-abdomen and lower abdomen, at saka dun sa lateral abdomen. So, ito yung mga stubborn areas. I think nag-exercise ka rin, hindi mo siya ma-dissolve or hindi mo siya ma-reduce. So, tulungan na po natin mabilis ma-reduce. So, I'll just pinch the skin like this, and then grasp ko yung fat tissue, and then perpendicularly, okay, I have a gauge 30 needle, and then pasok lang yung fat dissolving solution. Okay, how does it feel?
Feels fine. Feels like a pinch, actually.
Pinch lang yung masakit. Yun. That's the goal there. If i-pinch ko siya, doon siya masasaktan, and then subcutaneous layer, inject lang po. So we're just spreading this like 5 cc na gamot. Ikakalat lang po natin doon sa area na mayroong mga fats po. Yan. So, ideally, we can also do yung parang ice compress. Okay, so if you have the ice gel, we can at the same time compress with the ice. So, yung area na ating ini-injectionan, nagnanumb na rin siya. Okay? So, dun sa other side, ideally, you can inject for every area. Pwede yung halimbawa, you have this syringe here, 0.05 for every injection point. So, ini-spread lang natin. Pwede ka rin mag-pattern, like vertical, ganyan. Yung iba, mas malapit, they like do lang an inch apart, parang ganon. But in my case, I just really focus dun sa fat deposit. And then after that, meron naman akong machine. Ang ginagawa ng machine is, it's like an acoustic wave. Mag-spread yung fat dissolving solution towards dun sa fatty layer. So, parang equal lang yon. So, acoustic wave effect ng Ultraformer, it was a study done in Korea. So, nakakatulong daw once you inject this and then you do your Ultraformer, so may spread mo pa yung gamot all throughout the fatty layers. Okay? So, may additional, trivia.
yes.
Yan, so
How long does
natututo.
this take effect though?
Which one?
This procedure, how long will I see the effects?
Well, this one, may iba, mabilis mag-respond. Like, actually sa Ultraformer, after the procedure, we have done this. Pag mineasure mo, nabawas na. Meron yung immediate nakikita. The iba naman, 1 week, 2 weeks, 3 weeks, 4 weeks, basta within the first month, in the Ultraformer, up to 12 weeks eh. It's a case-to-case basis also. Some people have a faster metabolic rate, and bata ka pa, mabilis pa yung iyong BMR, yung basal metabolic rate. So, batang-bata pa. So, in your case, it might be a faster result.
So
Especially when you combine with your exercise and diet. Okay?
So it depends on your body type and age as well.
Body type, the age, your activities, your environment, and your genetic makeup. Okay, so many factors to consider also. So the younger the better, the earlier you start the better. Kasi you still have a control. And by the way, when we do this, we also select our patients. We assess their weight, body weight, aside from measuring the abdominal circumference, and then we get your BMI, your body mass index. So we have a gel here, okay, we'll apply the topical gel, and then we need the transducer ready. So this one, depending on the size, we can give like how many shots? 500 shots, 1,000 shots. I did mine 1,500 shots. But it was noticeable. A lot of people were noticing na pumayat daw ako. So,
Yeah, my mom said you lost a lot of weight.
yeah, I did. I think this is a 9mm. Do you have the 6mm, please? Okay. So I'll start with the 6mm for the upper abdomen. Now, Liana will tell us later on how does it feel. That will be her part to share with us the experience from this Ultraformer. So we're starting with the 6.0mm. Is that okay? Kaya? We can lower the energy. We can make it 1.2. Yeah, 1.2 of that.
I don't really feel anything.
Okay, that's a good thing. I like that. But you sense something like a prickly sensation,
I feel
right?
Like, dots.
Yeah, dots. So we can do like, for example, this part here, pwede natin gawin many shots, 100 shots this part here, and then this is just tuloy-tuloy lang. So ang sarap gawin actually, kahit
Like
kumakain
a massage,
ako.
actually.
Yeah, it's like a massaging also. So we'll probably be delivering several shots on this part, particularly sa side niya, kasi kailangan natin i-contour yung itong, what do you call this part here, Doctor? The lateral abdomen. Yung iba kasi, meron silang mga tinatawag na yung may love handles. Diba? You've heard of the love handles? Yan, ako naalis ko na yung love handle ko. Yung ba, saddle bags. Yan. Ano pa ba yung mga nakalawlaw sa ating tiyan? Or sa paligid ng ating tiyan? Or sa gilid-gilid? Or sa likod, yung mga flanks. So we can target this area. Like this is 6.0. Then I can shift to the 9.0. Yan. So the way to, you really have to put it back. So this is a versatile machine. It's a quick procedure. Then I can just continuously deliver the energy shots in this region. So nasa middle abdomen na po ako. So you're moving. Ang bilis, no? Actually, nakakailang shots na tayo. Malapit na sa 50.
na lang, ay 74.5 na lang siya. And then, the third po, ito kasi may pelvic, ano tayo dito, pelvic bone. So, asahan lang natin ng konti yung difference. So, it's from 85.5 cm. Ayan. 84.5 lang siya. And then, on the last marker natin, sa hip, of course, no, may bone pa rin dyan. That's from 87.5. Mag-aano siya ng okay, parang 85.5 na lang siya.
So now that we have known the actual results, how many centimeters were reduced from the abdominal region, let's ask Liana about her experience with these treatments.
At first, I thought that it would be really painful, but surprisingly, I didn't even feel anything, and I even felt good because it was kind of a abdominal massage.
Yeah, actually, I felt that too with the Ultraformer. I feel like I'm being massaged in the tummy region, and I feel like there's also a tightening sensation. Parang medyo humihigpit na after the treatment. That's expected po. Kasi you're targeting layers, soft tissue layers, Doktora. And somehow, pag na-zap mo yung fat layer na yon, actually may animation yun eh. Pag na-zap yung fat layer, nagko-contract siya.
Nagko-contract na kagad.
Yes, yan yung tightening na nararamdaman after the Ultraformer, and it's expected talaga. And ako, I have appreciated reduction instantly doon sa circumference ng tummy ko. Nakikita ko agad nagpa-flat na yung, lalo na yung may fat bulges ko. Ako, I'm already, I'm late 40s, so my metabolic rate is so slow already. That's why I needed help from all these machines. And the mesotherapy also.
Of course.
Right. So, yan, narinig natin kay Liana na hindi naman pala painful kasi some others are, yun nga, yung baka masakit.
Oo, baka masakit daw.
Okay, so sa inyo po na nanonood, kung meron po silang katanungan, you may email us at csaskinfinic@yahoo.com. We have our FB page, CSA Derm Centre, also Instagram, CSA Derm Centre. Ang aming clinic ay matatagpuan sa 2nd floor Pure Gold Daw Building, Daw MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193 or 0917-504-4268. And yung dating episode ni Liana, kung gusto ninyong makita yung before na itsura ng kanyang face, diba, may sinasabi siya sa akin eh, dun sa kanyang face contour dati. Anong tawag mo nga doon, Liana?
Jiggly, or like, one thing I noticed about my face is that it looks like I have marshmallows in my mouth. And whenever I would tap it, it would be jiggly, or whenever I would do any physical activities. So that procedure helped me to look good anytime at any angle.
Yay! Like that! So dati jiggly or marshmallow, ngayon contoured, perfect shape, V-contour, yan si Liana. So maraming salamat, Liana, Doktora.
Yes,
Sa
thank
inyong
you.
lahat, maraming salamat. God bless you all. When it comes to natural beauty, you can trust the CSA Surgery.